Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the President and CEO of Mayo Clinic Laboratories. This is our weekly discussion with Dr. Morice, in which we learn about updates in the field of laboratory medicine and pathology.
Hi, Bill. Welcome back.
Hi, Bobbi. Good to see you, as always. Can't believe it's
Yes.
almost the end of the summer, but it is.
Oh, don't say that. I'm still holding out for a little bit more of our nice summer days. Well, you've been busy, as always, traveling, and I understand you just participated in a webinar with the advisory board. I was wondering if you could share some of the highlights about what you discussed.
Yeah, no, I'd love to talk about that. It was really interesting. I was invited. Typically, they go in deep on a topic in this case in healthcare. Typically, just kind of with someone that's an expert walking them through a lot of data and what they see as market trends in different areas. This was one, around laboratory and diagnostic testing, and had the privilege of being invited as kind of an expert guest, if you will, to discuss that with them. So yeah, it was just a couple weeks ago. It was really interesting.
Yeah, and we'll post a link to that so that anyone listening to this podcast can also go and check it out at the source. But I think it'd be great to hit on some of the highlights. I know that you discussed the lab market outlook. Maybe that's a good place to start. What do you see in the future for the laboratory testing market?
Well, I mean, one of the interesting things is they looked at the data is actually there's been a kind of a drop in some routine testing, an increase in genetic
Mhm.
testing, which is, I guess not the drop in routine testing was a little surprising. I think some of that's driven still by changes in how patients are accessing care here post-COVID. But, I think the outlook is just essentially that we're going to see an increasing need for diagnostic testing across the spectrum from the more complex, what we call esoteric testing, to the more routine. We're going to continue to see growth in the need and the demand for testing, but at the same time, in that context, also dealing with some of the other factors that you and I have talked about before, and that is, you know, Medicare trying to control spending, so downward pressure on reimbursement, which we'll continue to see, and then also all the things around the regulatory challenges with FDA, which is still sort of out there. But I thought that they did a nice job of discussing the reality is that will increase the burden on diagnostic labs and how the tests that we do, particularly those of us that are more focused on LDTs, and how do we accommodate that. So I think the outlook is strong,
Mhm.
but there's still the same complex kind of dynamic that requires that those of us that are providing testing for healthcare have to really think about so that what we do is sustainable.
I agree, Bill. It sounds like some of the big trends in what you had talked about in your discussion was, well, our aging population for one, and that's going to drive a lot of the testing that's needed. These new and reemerging diseases that we keep having, and we'll be talking about mpox with Dr. Vinegar shortly, because there's some worrisome trends there. And of course, we've spoken about H5N1, and then also the technology innovations with the genetic testing. And
Yeah.
I did a little reading about from the National Council on Aging. They have some great statistics in the United States. Older Americans are, of course, living longer, healthier overall, living independently for longer. But most older people have at least one chronic health condition. And many people are dealing with multiple chronic health conditions. And it's the big ones that we know of: heart disease, diabetes. 20% of adults over the age of 65, I was surprised to see, have diabetes. And then obesity, significant cause of morbidity. And it's nearly 42% of older Americans over the age of 60 that are considered obese. And then, as we talked about in a recent podcast, dementia. So this is going to drive need for testing that encompasses all of these diseases.
Yeah, well, probably the most sobering about that is I turned 59 in a couple months, so now I'm approaching that threshold of an older American. But
Uh,
anyways,
but
I
you
kind of
don't have any risk for obesity. You're
not
so
right now.
active. Right.
Yeah, as long as I'm chasing those two little dogs around, I think I'm probably safe. But but no, it is very so. Stepping back, first of all, is you know all these factors that you speak to, right? And I think there's kind of I almost see sort of two big things going forward. On the one hand, in developed nations, we'll see an increasing burden of trying to manage an aging population off of a relatively smaller workforce that provides the tax basis and other things to support that, right? So that means we're going to be looking at keeping people healthier, keeping them in the workforce longer, all of these sorts of things. And so that's where, as we and I've talked about, like Alzheimer's disease, well, all those things now are driving therapeutic companies to develop effective therapies for these things, which means we have to more accurately diagnose and use innovative testing to think about getting those tools available. I mean, and it changes quickly. Like you talked about obesity. Think about the GLP-1 inhibitors that are out there. They're like changing overnight, kind of how we approach obesity and how we think about that. The other thing that will be interesting to follow for me. So we'll see a lot of innovation and tests in the laboratory, which we'll have to think about and and really be good stewards about how to best use those to address the pressing issues around like aging. The other is that as people age, there'll be people like me who probably are more comfortable with technology than maybe previous generations. So a lot of what we talked about at the advisory board was this trend towards digitization. We talk a lot about digital path, which is important, but the reality is, wearables and using other kind of data to manage chronic diseases with people that are willing to engage around, data from their watch or something else, actually going into healthcare and guiding when they get additional testing, I think is something we're really going to see grow over the next several years because it's really the best way to cap expenses is to use that kind of technology to control when people access care to make sure they're accessing care and getting testing additional testing when they really need it. That's all the Western, what I'd say, we're in developed healthcare economies. But on the backdrop of that is exactly what you mentioned: H5N1, monkeypox. We're going to see in the continued need post COVID, and with the trends around climate change and everything else I've talked about, and just a global society, how do we continue to increase diagnostics around emerging diseases too? And many of those are in areas with a less developed healthcare ecosystem or economy. So I think those are going to be two of the big macro issues that we see: testing for managing chronic conditions in a way that's effective and keeps people healthier longer in developed nations, at the same time increasing testing that allows us to detect emerging diseases that will continue to impact the globe.
Yeah, I like what you said a lot too about wearables. And I think that our population is much more amenable to wearing something on their wrist. I actually got to spend a couple hours in my local store trying to get a new phone this weekend because I dropped my old one too many times. And all of the people coming in getting new watches, and they wanted all the gizmos. They wanted their EKG to be monitored. They wanted their heart rate. And it was very popular. So I think more wearables that are consumer friendly are going to be used. Now, on the other hand, we have all these new tests coming out that are going to be very expensive, and Medicare spending is expected to increase almost 8% each year up to 2030. So we're really going to have to look at appropriate and effective use of some of these new tests that are coming out and make sure that we keep healthcare spending in under control.
Yep. And I think the flip side of that is, and again, going back to our consistent theme of staying engaged, it's like the reality is that yes, Medicare spending is going to go up. And we've talked a lot about PAMA, and that's still out there. And the proposed cuts to reimbursement to labs. Labs are still less than 5% of the total health Medicare spend, right? So, but yet they drive so many decisions. So it's more than just worrying about getting paid, but actually creating the argument for increased investment in diagnostics, which will save healthcare overall, right? So, and using the tools that are out there, I think that's one of the things that that was in the advisory board, was a sense that there's going to be fewer and fewer kind of companies that are providing diagnostics and organizations, I should say, that are providing diagnostics, because that's typically what you anticipate when there's downward pressure on reimbursement, is that they'll force consolidation. We're seeing some of that, but the reality is there's so many different avenues by which diagnostics provide care. I think there's always going to be a lot of different hospitals and healthcare organizations involved, but that's where we have to really change. We are in healthcare the best position to make those arguments about where investments in diagnostics will actually help save lives and improve healthcare efficiency overall. Going back to even COVID, and all the challenges with COVID testing being around access to testing, right? That was just needed overnight. So I think that's the flip
Yeah.
side of it, is thinking about that and being good. We have to advocate for ourselves, because when you bring up Medicare, I think about just even this year, it goes back to budget reconciliation and keeping spending at zero, which means they just figure out where they're going to cut. And that's where we have to think about, helping the government to understand where they should spend, because the return will be higher, right?
Yeah. Well, you mentioned investments and the importance of that. And sometimes you have to make an investment to have more efficient healthcare provision and perhaps even lower costs. I think of digital pathology as the perfect example of that. And I know that was something you had spoken about with the advisor group for an opportunity for growth. Do you want to just comment on the opportunities you see there?
Yeah, I mean, it's a very interesting one, right? Because one of the challenges we have in healthcare, and you and I've talked about this before, it's different than most other industries, where innovation in a lot of industry actually cuts out costs, whereas innovation in healthcare, and that's not just in the labs, tends to increase costs, right? And that's part of the challenge that we have. So digital pathology, great example. It's a significant financial lift to invest in digitizing your practice, because it doesn't reduce any work. It adds additional work to take a glass slide and put it into a digital environment. So you have to focus on the return. The return is more accurate diagnosis for patients. The return is greater efficiency on a shrinking workforce of pathologists that will increase access. You have to think about how you use digital pathology in a system approach to actually improve performance for patients, whether it's financial or accuracy or otherwise. And it's interesting, because it does appear now that a lot of the value in digital pathology is either through the use of algorithms and tools to help support diagnosis, or through networking. A lot of accurate histopathology diagnosis is just getting the right slide, or the right image in this case, to the right expert. So
Mhm.
me getting a lymph node for a lymphoma is great. You getting a lymph node to look for a pathogen like a cat scratch disease, so it's different. And so I think that's the promise of digital pathology. We're near a tipping point, and that's where you have to watch, because if you go too early, you'll have a hard time getting that return. But if you go too late, I do believe that for all of this, whether it's someone that's running a high throughput clinical laboratory, or a pathologist in their office, we're going to move to the period where those people who use the tools, whether it's like understanding wearables and how it drives volumes in your lab, or understanding digital pathology, how it drives efficiency and accurate diagnosis, those will be the individuals and the groups that will take the future of laboratory medicine. And those that do not will over time dwindle, because they just will struggle to participate. So yeah, I think that's a great example.
Yes, well, there's a well-known saying that AI will not replace us, but we will be replaced by people who use AI if we do not use AI. As we see these systems evolve. My laboratory, we've seen great efficiencies. I agree the cost is about the same. We had to purchase a scanner and a software system, but now we can handle a much higher volume. We're more efficient and we have more positive results, increased sensitivity. So at the end of everything, it was a win. But you have to look in the overall scope of the whole healthcare system.
Yep. I think that's the two things that I would say is, from a leadership perspective, um, you need vision, people like you that can paint the vision of that future state, and how it creates value for our patients, right? Because there's a whole change piece in the lab as well as outside the lab. And then the other, my favorite adage then with that in mind, is the best way to predict the future is to create it. So we can't
Yes.
stand on the sideline. We need to embrace the challenges, but we have to embrace those challenges understanding. And look, and I think that's what's nice about that webinar. It was they did a lot of work, the advisory group, in collecting a lot of really good content and data, and it's very helpful to look at that, because anything that we do has to be in the context of where we live today. So I think understanding that future state we're getting towards, but also understanding the challenges that we confront today and where we need to have a voice, then becomes critical.
Yeah, very well said. And I really appreciate getting the highlights of your webinar. And as I mentioned, we'll put the link in with our podcast so people can listen to the entire thing. But really appreciate the behind the scenes and the discussion of the highlights and the outlook and trends. So as always, Bill, thank you for a great conversation. Look forward to
But
many more.
And I appreciate your thoughtful leading of the conversation. So it's served us well here over the years. It's great.
Absolutely. All right, until next week. See you later.
Until next week, we'll see ya.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and don't forget to tune in every Thursday and every other Tuesday.